Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.
Welcome to KOCT Community Health Matters. My name is Ray Clendenning. Today we will be speaking with dental health staff at Vista Community Clinic. For more than 3 decades, families in San Diego, North County have depended upon Vista Community Clinic for affordable, high-quality health care. Dental care is one of the very important health services that Vista Community Clinic provides to patients of all ages. Our guest today is Dr. Rebecca Corneal, Director of Dental Health at VCC, who will tell us why dental care is especially important during pregnancy. Welcome, Dr. Corneal.
Thank you.
Dr. Corneal, can you give us an overview of dental services at VCC?
Yes, so as you mentioned, we see patients of all ages in our clinics, so adults and children alike. And we provide your basic exams, cleanings, fluoride, preventative type services, as well as fillings and restorations to take care of teeth that have cavities.
So can you tell us how VCC incorporates dental health in the overall prenatal care for a mom-to-be?
So for our moms-to-be who enroll in our prenatal program through VCC, we generate an automatic referral so that they know that part of their care as a prenatal patient includes seeing a dentist. And so we schedule those patients to see us in the dental department, and we complete a comprehensive exam that also includes a good deal of education on what to expect while you're expecting, and how to take care of your teeth and gums, as well as some of the things that to expect once the child's born.
Okay, so pregnancy is a time when women are overwhelmed with many things and in many ways, by morning sickness, fatigue, caring for children and work. Why is it important for an expectant mother to keep up with her dental appointments and to get regular dental care?
So we want to make sure that mom is as healthy as she can be in all aspects of her care during her pregnancy. So any way that we can both offer education and reduce any sort of dental disease that's actively going on with the mom, we know that's going to help not only her but her child that's developing and once the child's born.
Okay, so what are the advantages of good dental health for the mother-to-be and for the developing child?
So for the mother, if there's any gum disease, we can eliminate that or minimize it as much as possible through educating her on good oral hygiene, regular brushing twice a day, flossing to reduce the bacterial loads that are in the mouth, and decrease the risk of some studies have shown that there's the possibility of preterm birth that can occur if there's active gum disease. And also by eliminating the bacteria that causes cavities, we know that that bacteria can be transmitted to children after they're born. So if we're able to eliminate that while she's pregnant, we don't have to worry about that transmission through saliva after the baby's born.
That's really important. So what are some good dental routines that you recommend for your patients who are expecting?
So for our expectant mothers, the instructions are pretty much the same as what we would advise for any patient. We want to make sure you have a good habits of brushing twice a day, flossing at least once a day. One thing some mothers get concerned about is that their gum tissue might bleed a little bit more while they're pregnant just from the surge of hormones to support the pregnancy, and that's not to discourage them from flossing, but rather floss more often, make sure you're taking really good care of your teeth, reduce the plaque and bacteria in the mouth.
And so how often do you schedule the moms for those exams during pregnancy? Is it like every 6 months? Is it more often?
We still recommend every 6 months. In some cases, if there's more elevated levels or advanced stages of gum disease, we might recommend more frequent. So it's tailored to the individual needs, but the general rule is typically 6 months.
Is there anything else that you would want us to know for an expectant mother with regards to taking care of herself and her baby and definitely the care of the dental care?
Just basically to make sure that you're taking good care of yourself. So I think that it's a time of excitement and a little bit of worry, and there's a lot of different changes going on in the body, and it's to make sure that you don't ignore certain aspects of your health. Sometimes 6 months goes by really quick, and all of a sudden it's time to go to the dentist again. And if a mom's not feeling so good because of morning sickness or other reasons, it's still important to see us so that we can catch any problems early.
So the challenges that you might face with a mom who comes in and she's getting the care and maybe she's not taking care of her teeth in quite the way that you'd like for her to. Are there any suggestions that you give to them or ways that they might improve the dental health that you're wanting them to have while they're pregnant?
Well, for mothers who have morning sickness, it's making sure that they're eating what they can tolerate, but to steer clear of some sugary foods and acidic producing foods as much as possible, because if they aren't feeling well, if there is some vomiting, the acid changes and the pH change of the saliva can cause decay to happen a little bit more quickly. So we don't want to encourage that through ingesting sugary foods and drinks.
So if I'm a citizen here in the Oceanside or Vista area, where might I go to access your services?
So currently we have two clinics, two dental clinics. One is in Vista off of Vail Terrace, which is our main clinic that offers a broad spectrum of care. So the dental department is there on the second floor. And then we have a new clinic that we just opened in June in Oceanside off of North River Road. And we have building a small little campus over there so far at the Libby Lake Community Center. And our dental services are in one of those buildings, labeled very well. And like I said, it's brand new, just opened in June, and it's beautiful.
And who can access those services?
Anybody that wants to come see us is welcome to come see us. We're able to provide for patients who are insured through Medi-Cal, as well as a variety of other programs. And even those without insurance are able to access care through different programs that we might have to offer. So you can always give us a call and see what options there are for you.
Okay. So again, any other tips that you might have for those moms who are expecting or looking forward to or those babies are coming?
Just don't forget about your teeth in all those appointments. Make sure a dental visit is still included in that, and you do everything you can to make sure you're as healthy as possible.
How long have you been working for Vista Community Clinic?
I've been with Vista for a little over 5 years and a director there during that time. So we've gone from just one clinic in Vista to expanding to Oceanside, and we have more expansion and more growth on the way.
Dr. Corneal, thank you very much for being here today and educating us on this very important health matter.
Thanks for having me.
After the break, Mackenzie Faramon, Clinical Services Manager of Vista Community Clinic, will be joining us.
So you see, son, good manners are important. Should I go through it again?
Yes.
Yes, please.
Yes, please.
Exactly. Always say please, thank you, you're welcome, excuse me, sit up straight, hold doors open for ladies. If the door's locked, knock first, don't burp, don't swear, don't stare, don't use bad language, or talk with your mouth full, keep your elbows off the table.
What table?
And don't interrupt. Cover your mouth when you cough or sneeze. On the bus, give your seat up to anybody who has trouble standing. Bottom line, treat others the way you want to be treated. Got it?
Got it.
Good talk.
Most parenting is hard to do in just 2 minutes. But 2 minutes twice a day making sure they brush is easier, and it could help save them from a lifetime of tooth pain.
Right, mi cariño. So like I said, everything I learned about cooking, I learned from Grandma's empanadas. Shall we go again?
Yep.
Mix beef with the onions with the peppers with the paprika with the garlic with the oregano with the cumin. Got it?
Got it.
Throw on the olives, stir, season, stir again, pour out the flour, roll out the dough, make a circle, drop in a fistful of filling, fold over, press down, and ta-da!
Most parenting is hard to do in just 2 minutes. But 2 minutes twice a day making sure they brush is easier, and it could help save them from a lifetime of tooth pain.
Welcome back. My guest on this segment is Mackenzie Faramon. Welcome, Mackenzie.
Thanks.
Mackenzie, would you share with us what are some of the barriers that prevent families from seeking dental care for their children?
Yeah, sure. I think one of the biggest barriers that we've recognized is families are nervous about the cost. Dental care can be expensive, but a lot of families aren't aware of all of the programs that we have at VCC that make it affordable for families to get the care they need. I think a lot of these families have attempted to apply to health insurance but have been discouraged by the process. So that's something that we would like to help with as well.
Okay. So there's a new program that you have implemented called A+ Teeth. Tell me about it.
Yeah, so A+ Teeth is our mobile dental program, and we have partnered with schools and community organizations to provide preventative care. So we go in and we provide visual dental exams, fluoride application, and sealants when they're needed.
That sounds like a really wonderful program. Where do you provide these services?
So right now we're partnered with the Vista and Oceanside school districts. We visit about 25 of their schools, and we actually bring the mobile unit to the schools, and we bring our whole team, the dentist, the assistant, the program staff to the schools. We've also partnered with community organizations like WIC and Boys and Girls Club.
Okay. And the ages of the students who participate in this program?
Yeah, we do pre-K through 8th grade. So we see middle schoolers and kindergartners and kind of a wide range.
Wonderful. And so are the services free?
They are free. The families never receive a bill for these services. We do, because Medi-Cal does cover the preventative services, we do ask that they provide us with the information if they do have Medi-Cal. That way we can continue to see kids who do not have insurance and are in need of the care for free.
Okay. So how does a child who receives A+ Teeth care in his or her school, do they still need to go to the dentist?
They do. So these services that we provide are preventative. So we're hoping to prevent future cavities, or so they still need to go see a dentist to have a comprehensive exam that includes x-rays.
And can they get those services at VCC as well?
Yes, we would love them to come and get those services at Vista Community Clinic.
So what's the response been for the schools to whom you're providing these services?
I think in the beginning we faced some skepticism. We came in and offered free services for any child that wanted to sign up, and I think they were a little nervous to provide a service if it wasn't going to be truly free. But now that we've had the chance to be in the schools and provide quality care for free, I think we've built a lot of trust with the schools and the organizations as well as the families.
And the parents and the administrators, what are they telling you about the impact of A+ Teeth on their kids?
Yeah, I think it's been a great relationship that we've been able to build with them. We've not only provided them with free services, but we've gotten the chance to educate children on oral health and oral hygiene, and some of them come to us and they've never seen floss or don't know that you have to brush twice a day. So sitting with them and going through that process and making sure that they walk away with some more knowledge on their dental care has been huge.
And so are you educating parents along with the students in A+ Teeth?
Well, when we are at the schools, we only see the child. But the great thing about this program is that it's 2 parts. So the second part is care coordination.
Okay.
And our care coordinator connects the families with care. So we don't want to just say, your kid has 9 cavities, good luck. We'd like to bring them in, talk to them about the services that we can provide, and also educate the parents on the availability of our dental services as well as our insurance enrollment assistance. Okay.
Thank you, Mackenzie, for being here today and sharing with us about A+ Teeth and the work that you're doing at VCC. After the break, Dr. Rebecca Corneal will be joining us again discussing pediatric dentistry.
Will spend 15 minutes watching online videos like this one.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes, twice a day. They have the time.
Welcome back. Joining us again is Dr. Rebecca Corneal on the topic of pediatric dentistry at Vista Community Clinic. Dr. Cornell, thanks for chatting with me again. We just spoke with someone who told us about the A+ Teeth program at Vista Community Clinic. Will you share with us at what age a child should begin to see the dentist?
So we like to see a child as soon as there are teeth, and the average age of that first tooth coming into the mouth is typically around 6 months. It can vary in each child, more or less than 6 months. So in some cases, children can be born with teeth, believe it or not, and in some cases, you might not see that first tooth till age 1.
So what are the services that you provide in the first 3 years of life?
In the first 3 years of life, we provide a lot of education and visual exams. So obviously children this age don't necessarily need x-rays, nor could they be cooperative for them. So it's a lot of visual exams where we look at the teeth, make sure that everything is developing normally, coming in normally. We educate the parents on what to expect while they're teething, how to keep them comfortable, how to care for the teeth, such as brushing and flossing. And yes, you need to start flossing even when there's only a tooth or two. And then we also place fluoride varnishes to help prevent cavities.
Okay. And so how often should a school-aged child visit the dentist?
We like to see them every 6 months, and of course if something comes up that a parent finds unusual or is concerned about, or if the child takes a fall or bumps their mouth or their teeth, we want them to bring them in so we can take a look and make sure everything's okay.
Okay, so how do untreated dental issues like cavities affect a child's overall health, schoolwork, and other activities?
So cavities can be very disruptive to just the normal development of a child, especially once they're school-aged, because if there's a lot of need to have treatment and to see a dentist frequently, they might miss quite a bit of school. Pain, of course. So a lot of these cavities, if left untreated, can develop into much bigger problems where the child can have pain, develop infection. So it also can affect their social interactions at school too. So if there's unsightly cavities or for kids that have to have a lot of dental treatment, other kids notice and point that out sometimes. And so we want to make sure that we're preventing those problems before they become big.
What advice do you give children and parents on what they can do at home daily to maintain good dental health?
So your basic brushing and flossing, as always. We want to make sure that I tell kids, before you go to school or after you eat breakfast, because otherwise sometimes they try to take the weekends off. And then before bed as well, making sure that they're brushing and flossing. We go over diet guidelines as well. So we want to make sure that they're eating healthy foods, low sugar, fruits and vegetables, cheese, yogurt, things like that don't cause cavities, and stay away from the candies or the treats more on special occasions. Some of the things that parents sometimes don't think about are what they're drinking or what the children are drinking. So Gatorade, soda, things like that have a lot of sugar in them, we want to steer clear of. We want to recommend mostly just milk and water, lots of water, and fluoridated water. So that would be the water that you get from the tap or that you filter at home or that you get filtered from the store, but not necessarily the bottled water.
Oh. So bottled water doesn't contain fluoride?
Typically does not. There are a few brands that do. You have to check the bottles, and typically it's in some of the pediatric type water preparations, but your basic bottled water that you buy, you don't get the fluoride, so you're missing out on that benefit.
All right, that's something that's good to know because I didn't know that. I wasn't aware of that. Is there anything else that you want to share with the viewers regarding just really good pediatric health care for their children?
Just to make sure that they see us every 6 months, that they work with their kids at home on the importance of brushing and flossing. A lot of the times parents will say, well, they don't like to do it, but sometimes you have to make it fun. There's different games and activities, songs, television shows, books that they can read to help them get used to the idea of seeing a dentist. Playing dentist at home where you count teeth, you brush teeth, you floss. Things like that make going to the dentist a lot easier, and it makes it more fun for the child too.
I know as an adult I have a time with my flossing, so what's a good way to help me and the kids to do a better job with that?
Well, I don't know if you like stickers, but We do, you recommend like charts and things like that, because kids get super excited if they can put a sticker on a chart, you know, that they floss their teeth, similar to like reading books or, you know, and things like that. Little rewards and incentives, but mostly just making it a routine and sometimes doing it together. So the parent and child together in the bathroom, brushing and flossing, you spend some time together. You can turn on the radio, get some music, because that's about the average amount of time that you want to spend brushing is about 2 minutes, so a song.
All right, good. That's great advice. Well, thank you so much for being with me today.
Thank you for having me.
This brings us to the end of our show on dental health services at VCC. Thank you for watching KOCT Community Health Matters.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.